Thank you for joining us today for the Leading the Way, a panel discussion on family well-being, hosted by Lead United. So welcome to Lead United members and guests. My name is Andrea Whitcomb. I am the co-chair of the Lead United Council. I also work at CUNA Mutual Group here in the Madison area. So really excited to be here today with all of you to kick off one of our events that we have throughout the year. I know this one did got changed about a month ago to move it to virtual. So thank you for joining us virtually today. I do want to give a special welcome to any of our Lead United Step Up members who are joining us today. For those of you who don't know, the Lead United Step Up program was new in 2021, and it provides donors the opportunity to make a commitment to their gift to Lead United level of $1,000 over the course of 3 years. So thanks to our Centennial Match Fund, all Step Up gifts unlock funds to be invested in the United Way Foundation to support critical United Way resource hubs like the Volunteer Center and 211 for many years to come. We know our Lead United network is invested, compassionate, and focused on understanding Dane County's most critical issues in achieving professional growth. Together, our gifts make real measurable change and maximize the full potential of our Dane County community. So exciting this afternoon, we'll learn more about the 2-generational approach to family well-being in Dane County and the partners we are committed to. We are so grateful today to be joined by a wonderful panel representing 3 partner agencies within our community. So I want to give a warm welcome first to Abbi Kruse. Abbi joins us as executive director from the Playing Field. The Playing Field works to break down barriers faced by low-income families in accessing high-quality early care and education. This program provides childcare while supporting families to find stable housing, quality early education, and employment opportunities. So welcome, Abbi.
Thank you.
We're also joined by Sharyl Kato. Sharyl is the Executive Director and Child and Family Therapist at the Rainbow Project, Inc. Rainbow Project offers a full range of best practice services for children and families who have experienced trauma. Their 2-gen family and school readiness program provides trauma-literate, culturally appropriate behavioral health resources and support for pre-K children and their families. Welcome, Sharyl. We're happy to have you. And I'd also like to welcome Scott Strong. So Scott is the Executive Director of RISE Wisconsin. RISE provides care coordination, home visiting, and therapeutic support to children and their families to help them achieve success at home and in the community. Their Parent Child Plus program is an early literacy home visiting program that helps parents and caregivers prepare their children for 4K. So welcome, Scott. Happy to have you today.
Thank you.
And lastly, I'd like to introduce our panel moderator for today, Sheldon Hitchens. So Sheldon is a director of 2-gen initiatives at the United Way of Dane County. So I'll pass it over to Sheldon to do a quick 2-gen overview and then go into our panel discussion. Hi, Sheldon.
Hello, hi everyone. It's great to be here. I hope you can see me. I can't see me, but okay, but you can see me. Okay, there we go. It's good to be here. It's good to have all of you here. First and foremost, thank all of you for your generous contributions to the work that United Way is supporting throughout the community. And then also thanking our esteemed panelists as people who are in the trenches doing the work, who we are happy to support and have lead this work in our community around early childhood and family well-being. So I'll just jump in and just do a quick overview around what we mean when we say family well-being at United Way and how it kind of fits into the 2-gen picture. So regarding family well-being, we understand that in the early childhood space, or even in just the child development space, that when both the child is developmentally ready for kindergarten, for instance, and the family has stable housing and food security and all of the things that we know families need to live and thrive, then we can reach family well-being, right? In the areas of education, income, and health in particular, we're focused on at United Way. And so um, when we think about the 2-gen programs, we're trying to touch families at all of those different entryways. So Sharyl will talk about the work that we do with mental health, and Abbi will talk about some of the work we do with childcare and with homelessness prevention for families with young children. And Scott will talk about some of the work that we do in home visiting and working with families and housing case management, and just some other ways we're trying to make sure that families get the wraparound supports they need in order to have what we're calling well-being. So that's what we're talking about when we say family well-being. How do we address the disparities by race and by class in our community so that all families have the things they need to not only survive, but to thrive, and for their children and their legacy to thrive as well. So moving to the next slide. And so we mentioned that we do this in 3 areas. So we have a vision for education, a vision for income, a vision for health. And our 2-gen programs work across and within all of the areas. So we understand that that families are not only dealing with one challenge, right? But that there are multiple challenges across different areas. And so we want to be we're very intentional in the 2-gen space to couple these different areas in different ways in order to reach families and respond to all of their needs. And so the 2-gen work is keenly focused on families with children under 5 who are experiencing poverty. So all of our work in 2-gen is early childhood work. So we're thinking from conception to kindergarten is really what we are interested in addressing in the 2-gen space. And so in addition to making sure that families who might be experiencing poverty have the access to those cross-generational supports, we also really want to work intentionally to be sure that we are impacting kind of this large data set of children under 5 in Dane County who are experiencing poverty. And when we see those numbers changing, being decreased, we know that the work we're doing is having a long and lasting impact. And we don't do this work alone. So we work with thousands of families. We work with hundreds of volunteers and dozens of community partners and agencies and programs in order to move the needle on some of these kind of bigger community level indicators. And we are grateful that we are able to be in a position to provide space for the conversation to happen and for the work to be done, and to also rally the community around our big goals and the progress we hope to see for families in Dane County. So that was our overview. And so we'll jump right into some questions that we have for our panelists. And how we'll do this, I will pose the question, and then I will allow each of the panelists to respond. I will, let's just stay in line. So we'll say Sheryl is going to be our first responder, Abbi will be our second, and then Scott will be our third, and we'll keep that order. if during the conversation, panelists, you feel the need to have a conversation or to socialize something a little bit further with one another, feel free to do that. We have some flexibility in this space. So our first question to get us started with Cheryl's response is, United Way's 2Gen work centers families with children under 5 who are experiencing poverty. What are some of the challenges you address with these families?
Oh, okay. So I'm trying to be succinct here, but I'm first of all really excited that this is happening. And one of the things that we're seeing as a challenge is access to healthcare. One of the things that we're most concerned about for the BIPOC community are the data that we're seeing, and unfortunately, it can be across the country, of the incidence of healthcare for pregnant moms who are really not having the kind of support that they need. And there is, we were a full week in New Orleans recently for a conference, and they talked about San Francisco's hospital and innovation for addressing this issue of high infant mortality in the BIPOC community. And if you really balanced and evened it out with the factor of poverty, you're already going to be reducing that, you're going to be increasing the solutions to those healthy pregnancies. And so they did that in a particular community with outreach and increased the success by 47%. So we're looking at healthcare access as primary, but I also think we're looking at fragmented services. One of the things that is so important about this population is the brain development information now, but also developmental information about attachment. And when you don't have that in terms of the parent and that child, you really are going to be fragmenting the developmental foundation for future areas of growth. And that can include physically. We have children who are failure to thrive. We have so many services that are not really being timely. And there are so many waiting lists. So that is a particular one. The other is the ability to reach different populations and really understand those populations and not expect, for example, folks to come to us, that we really need to do the outgoing kinds of information. And I think socially, society-wise, we're not really providing the developmental information for parenting that I think in all populations is something that's that is acceptable. So I see that, and of course the institutional racism of how certain families have access and not. Great example is a father who is just coming out of prison. He really is ready and able to work with his family again. But the perfect psychotropic medications he had in prison are no longer available once he is out. And it seems that those kinds of seamlessness are really devastating for families when psychotropic medications are just not available, and a real setup for families when they don't have that kind of care. And then what do they do when they have so many other burdens to address? But as I say, I could go on, but I will stop there, Sheldon.
Thanks so much, Cheryl. So Abbi, just a reminder of the question, what, from your vantage point, what are the issues that families with children under 5 who are experiencing poverty, what are some of the challenges and issues you see in that space?
Yeah, so the playing field has really focused our efforts on breaking barriers for families in accessing high quality early childhood. We see a lot of families that don't have access to quality care, and the choice is leaving their kids in a less than suitable environment, or going and, not going to work or school or whatever opportunities they have. And so we've really been intentional about breaking the barriers that families face in accessing high quality care. And some of those barriers include cost. No families ever charged a copay to attend our program. Transportation, we pick up children from all over the Madison city limits. We've picked up kids from shelters, hotels. We've picked up children that have slept in a vehicle the night before. We have children who don't know from day to day where they're going to be at. So that's been one of the barriers. We've updated our facilities so that if a child arrives in need of a bath, we can give them a bath. If they need their clothes washed, we can wash their clothes. But we've really just been, even policies, like looked at what are the policies that make people feel not welcome in a quality program. One example that seems really small is birthday invitations, right? It doesn't feel great every week to tell your child, we can't go to the birthday party, we don't have a way to get there, we don't have a gift, whatever. So some of those policies we've really been intentional about. And then one of the biggest ones is trauma sensitive practice. A lot of our kids who've already been impacted by trauma are going to quickly be expelled from typical programs. Just as an example, we had 2-year-old twins enroll last summer. They were kicked out of a program within 45 minutes.
Wow.
So, the behaviors associated with early trauma, if a child care is not prepared to handle and address those, they misinterpret them. And the people that pay are the children and their families.
Thank you so much. I'm just plugging in my computer here. Thanks, Scott. Time for you to weigh in. What, from your vantage point, are the issues impacting families with children under 5 who might be experiencing poverty?
Well, certainly we see all the things that Abbi and Sharyl have talked about, but just as a general overview with home visiting, we are pretty well connected, providing a pretty comprehensive array of services and supports to families. And so we see affordable housing, affordable childcare, trauma, mental health needs, affordable wage and employment, all is really major issues that the families are facing and children under 5 are facing. And then the systems barriers and access to services that Sharyl talked about really makes that more difficult, because trying to get into those services are hard. So with our home visiting programs, our Welcome Baby and Beyond and our Parent Child Plus program, what we're trying to do is really take a really comprehensive approach to connect families to those services and partner with other organizations that can provide that. And while we're addressing the early childhood developmental needs and the parent-child interaction, we're also helping them get connected so they can really attend to what their child needs as they are developing. We also support parents while she's pregnant to make sure that she's getting her well baby checkups and their health care is being addressed. So we, right from the get-go, we want to make sure that the families have what they need to be strong and supportive, and that the parents are learning what the developmental needs of their child are so they can be responsive. To help that child have different experiences than what the parent may have had, and really interrupt cycles of trauma. And with our Parent Child Plus program, early literacy is and school readiness is a huge barrier for children living in poverty. So we are identifying those early childhood literacy needs and ensuring that families and children have the educational tools, books, toys, and that parent-child interaction as the parent is the child's first teacher to get them off to that healthy start. So all the barriers that were identified before, and then just really focused on those early literacy and early developmental milestones are really important.
Yes. Thank you, panelists, for your responses to that first question. So moving a little bit more into talking about the model that we're using at United Way to really deliver these 2 gen programs in the community. So back to you, Sharyl. Can you describe the collaboration model? Who do you work with, and how does working together benefit families?
Mm-hmm. Well, I think
I'm also going to put these. I'm also going to put the questions in the chat if people need to go.
Okay. I think that next month, Rainbow will be celebrating 42 years of service in the community. And one of the things that we have always supported is that we do not work with children in isolation. It has always been with families, including 2 or 3 generations. And in working with trauma, and that's going across the continuum of prevention all the way to crisis and intensive trauma treatment, we're really seeing those early years, as we mentioned, so critical. But the collaborations are amazing, and it is a matter of how radical we are in our collaboration, not just referrals in community. And a good example is our current relationship with Goodman Center, and how we're able to be in a least restrictive way able to work with families so readily. We're picky about our partners. We want them to be strong. And it really is exciting to be able to work with them so that the transitions are more seamless. We all know the stigmas of mental health services. And sometimes with us being available and interacting in the classrooms and really seeing that as a positive before they're reaching public school and kindergarten, many parents want to make sure that is a healthy start. And so we're really saying this is a plus, this is a luxury to really be able to have that proactive start with their kids. So we really do work with them. But in addition to the Goodman Center, we're working with physicians, we're working with speech and language therapists, we're working sometimes with law enforcement, we're working with extended family, so many other agencies. And I think a challenge is it can be kind of messy, but that it is the majority of the time very rewarding. And once you have those successes, it's very difficult to tolerate not having them, in terms of really having that seamlessness to pass the baton on. Because if you don't, in trauma, then United Way's education, income, and health agendas are all really impacted successfully, because trauma can impact all 3 of them. It is difficult to hold a job if you have not resolved some of those trauma issues. There are drug abuse, substance abuse issues, as well as mental health issues. And the earlier on, the better. So it's many, many collaborations that are really working. And it's wonderful to be able to do that and have those tight relationships.
Excellent. Thanks. Abbi, can you talk a little bit about your collaboration model and what benefits it might bring to your work?
Yeah, for sure. Like Cheryl, we have a lot of partners, and we want our partners to be strong as well. For the 2-gen model, we are partnering directly with the Road Home. And we partnered loosely with the Road Home since we opened 7 years ago. We just found that we were serving a lot of families in common. And partnering with the Road Home allowed us, each agency, to focus on what we do well. We do early education really well. They do housing really well. And you can't separate, right? You can't separate the child from the family, or the family from the child. They're not 2 issues. It's one family. And so when we started the 2-gen collaboration, the Road Home actually opened a housing development very close to our new East Side Center. And we've been able to collaborate with families, making sure that they have access to stable, affordable housing and reliable childcare that's very seamless. Our other partners are also Madison College and the Plumbers Union, and we're working with them to develop career training paths for people, for our adult family members. So we're very excited about the collaboration and the opportunity to support families in reaching their own individual goals and objectives.
Excellent. Abbi, were you kind of froze? Were you done with your comments?
Yes. Am I still frozen?
Okay, no, you're back, but you did
Okay.
freeze. I want to be sure you got to finish. Go ahead, Scott. I'm sorry.
All right. So we were involved in a couple collaborations, but really what we try to do is take our collaborations are predicated on more of a comprehensive wraparound model of care for families that are involved in home visiting within the early childhood zones. And those are throughout Dane County. And the agencies collaborate around the housing, food, education, employment, mental health, childcare services, and home visiting, early childhood development. Those are the main services that we provide within our collaborations. The nice thing is families can voluntarily choose any 1, 2, 3, or 4 of those services that meet their needs. We individualize their care so they can identify where they want and need the supports, and they can get those as they see fit. So we do not take a one-size-fits-all approach. We really do try to individualize the care so they can have their choices met. Formally, within the early childhood zones, we partner with Children's Hospital Community Services folks, Forward Services Corporation, Food Share Employment and Training, Community Action Coalition, Sunshine Place, and Rainbow Project. So those are all organizations that when we coordinate those agencies and the services delivered to make sure that we have that wraparound approach to address all of the family's needs. Informally, probably like Abby and Cheryl, we partner with many other organizations throughout Dane County to support families, but those are ones I mentioned were formal partnerships. How that helps families, the nice thing is it brings together a diverse set of providers who can jointly meet the individualized needs of each family. The families have ready access to those services and those agencies. They don't need to make multiple calls or referrals to access the services. We're all located generally in one place or have relationships developed. The needs are prioritized for the families, and we can do warm handoffs. So because one of our staff knows one of Cheryl's staff, they can make that handoff to mental health services pretty readily. And by working more closely as partners, the family feels like they're ready to trust the other partner, because it almost feels like we're working as one organization. They don't have to go through a lot of different hoops and steps to get services to access. We also have a partnership with the Road Home around the Building Futures program, but essentially that's bringing home visiting into housing. So as the Road Home works to on the rapid rehousing for families, we've identified that there is a need and a lot of requests from families for early childhood development. And so we have a home visitor that partners directly with the Road Home to provide those early childhood development services while they provide the housing case management services. So again, it's just those partnerships, those intentional partnerships really make a difference for families because they see that connection, it reduces barriers, and it really kind of taps into building the trust that families have in providers.
Thanks for that. Scott, would you mind telling us a little bit more for folks who might not know what home visiting is?
Yeah, home visiting, excuse me, it's we have a family support specialist is what their title is. They are trained in early childhood development, and so essentially it's care coordination for the family. So they go in and with the family into the home, in the community, wherever the family wants to meet, and we do a variety of different screenings and assessments to determine are there levels of trauma, mental health needs in the family, what the developmental milestones or what developmental needs are for a child. And then we help put together a plan for the family to address those. We know that parenting is difficult under the best of circumstances, and none of us are necessarily trained to become a parent. So the home visiting just is another support to the parent to help them understand how to have that healthy parent-child interaction and attachment. We know if there's trauma that carries down from generation to generation, it interrupts the attachment that a child might have to their parent. And so we really want to address that early attachment, early connection that interrupts those cycles of trauma, and gets the family off to a healthy start. So that's a very high level overview. I hope that helped, Sheldon.
Yeah, absolutely. So the next question is about United Way support and how it might increase your capacity to do the work. So how has United Way support increased your capacity to serve families in our community? How does continued support from people like the people on this call who give to United Way, how does their support continue to help your efforts for reaching these families?
Well, to me, readiness, it's the right service at the right time that is so essential. And having that kind of funding support really enables us to do that. We all have waiting lists, and unfortunately, it makes it difficult. And there have been times when we've had folks really meet tragedy waiting on the waiting list. And that is frustrating for everyone, including death. So I think that with the increase in referrals, that's wonderful. But I think we need to make sure we're really supporting those services that are needed. And that is something that United Way funding is allowing us to be able to do. We need, because we are so interdependent, we need respite. We need all of the above in order to work with our families. I was on a meeting this morning with the Commission on Sensitive Crimes, and there were 6 different agencies that were involved in a case we were involved in, where there was a high court case that turned out really, really successfully because of everyone who really had their own expertise do what they needed to, including the hospital exams when there is a sexual assault with a child. There are really just so many intricate ways that we work together, including in housing and stability during COVID, that is allowing us to be able to say, this is a secure human services delivery system that really understands what's needed, and it isn't going to change year to year. That to me is really important.
Excellent. Abby?
The United Way actually, the support that we got from the United Way actually allowed us to replicate our model and open another location on the east side of Madison, expanding the number of families we could serve overall. A lot of our families qualify for a childcare subsidy through the state, but the childcare subsidy dollars do not fund what is really a quality program. The United Way dollars make up the difference between what a childcare subsidy pays for and what quality really looks like. They also allow us to meet the needs of children who are impacted by trauma, who would be quickly suspended or expelled. And those suspensions and expulsions, there are 250 preschoolers suspended or expelled every day in our country. The preschool expulsion rates are extremely high because most programs are not built to accommodate children who have been impacted by trauma. And so you just see these children be passed from center to center to center while families are in a panic about how they're going to maintain employment if they can't maintain childcare. And obviously there's just that ripple effect for them. So the United Way money pays for us to have lower child ratios, so teachers can attend to the individual needs of children. It pays for us to do extensive training with our staff so that we can really say that we're trauma sensitive and that we are knowledgeable and operating out of best practice. Do a ton of training with our staff. Another thing that we really didn't anticipate was that level of training and support that we're able to give our teachers has resulted in a very low staff turnover rate for us, which is pretty remarkable that we're seeing a reduction in turnover during the middle of a pandemic when everyone's getting out of education. So the United Way, when we opened that center on the east side of Madison, we didn't know this, but we were exactly where we needed to be. There were over 60 families living in a hotel right behind us. And a lot of those folks were able to return to work for the first time since the pandemic had hit. So it's been a huge thing for the community on the east side, and for folks that have been impacted by homelessness in that area.
Yeah, and United Way is also helping you with your transportation plan, helping you, purchase a new vehicle so that more people have access regardless of the weather or location. And I also want to, you all are probably better at articulating this than I am, so feel free to jump in. But when we're talking about childhood and family trauma, we're not only talking about physical abuse, sexual abuse. The experience of poverty itself is traumatizing to adults and to children. Not having food, not having health care, being in, having to move around, several times a year. All of that impacts and contributes to the trauma that we're talking about with families, right?
Yes.
Absolutely. We had this little guy who was 2 years old in our program, and our mental health consultant came in with a clicker and clocked every act of aggression. And it was 75 acts per hour. And not because he was a mean child or a flawed child. He was a stressed child, right? He didn't know from day to day. He would wake up after nap time and say, where am I going to sleep tonight? None of us are our best when we're living under stress. Why would young children be any different? So absolutely.
Okay.
And I hadn't forgotten about the vehicle, Sheldon. I was saving that for the next question.
I know you didn't forget, but I just wanted to put that in there. And so, yeah, absolutely. Thank you for that response. So, talking about trauma and our ability to address some of these larger issues with families, Scott, how does the support from United Way help you all do that?
Yeah, I think that the 2-gen approach in United Way's support of that has really helped expand the opportunity to have more formal partnerships and develop more models, such as like Northside Early Childhood Zone and the Building Futures program that we work with the Road Home. There were things that we did partner quite frequently already, but by taking a risk and saying, do formal partnerships and think outside the box. What are you seeing that's a need? We were able to conceptualize, we knew where some of the gaps were. And we were able to kind of take the 2-generational funding and begin to formalize those. So we were actually being more responsive to families. So I think that's the biggest piece, is using United Way structure and the funding to be responsive. So there's a lot happening in Dane County, but if we're not coordinating the services, we don't know if we're duplicating or missing. And so in this way, we're really reducing the amount of duplication that we're providing, and we're actually reducing the amount of gaps that are being missed. So I think that's a huge thing. United Way is good about convening delegations to take a look at a challenge within the community. And that's what started the 2-generational approach through your Strong Roots delegation, and really focus in on root causes in early childhood needs. And so, the three of us are talking about how that investment is really helping shed light on working more upstream instead of downstream for families, and really interrupting cycles of trauma so kids don't end up at 7, 8, 9 years old having behaviors that are getting them kicked out of school. We're addressing that early on and preventing that where we can.
Absolutely. Thank you all for that. So I'm gonna put the next 2 questions together for the interest of time, and you can answer one or both of these, but I did want to leave some time for some questions, so we'll maybe have like 5 or so minutes for that. So the questions are, what is, and you started to talk about this, so what is the value add for working with United Way beyond just the dollars? And do you have any success stories that you can share from the work you do with families that is supported by United Way.
Yeah, one of the things that I wanted to add that I've always been impressed with as critical in United Way, really working to educate the private sector. I remember being a part of the Born Learning delegation and the heavy lifting of research that United Way often does in providing that kind of education. So that in the community, in the private sector understands the nonprofit human services sector and really has that bridge there. It's essential. I remember being at a community event talking about early childhood programs and how important attachment is. And we had a CEO from a bank stood up and actually did an incredible, beautiful job of understanding, and that is worth a great deal. So I think that that can't be underestimated. I think one of the examples that I think about is a child who was in high quality childcare. When Abby was talking about how crucial it is. So much of the research right now is showing that if you can really respond to a crisis, for example, within the first 3 to 4 weeks, you can stabilize a family and really prevent post-traumatic stress disorder later in the future. So we've been able to do that in a more timely way. But another child who had been in 4 severe abuse situations before she was 3 years old was in high quality centers. And as the research shows, yes, it's bad news when you see when a child has been abused and you see the MRI or a TRI of the brain scan, and it looks very permanent, the damage. You can see the stems from brain stem. But when they are, the good news is Robert Anda and some of the others are doing research that the persistence and consistency of attunement, nurturing, and compassion really does help change that, which looks so permanent. And you can see new pathways from that brain stem. So that's why we're devoted to this younger age. We work with infants through middle school and have seen that kind of change happen. We have testified in court because they ask, why has this child been so resilient? And so I think those are some of the important things that a child that I worked with went through this, and in each way, which is why we can't work in isolation. We need to educate some of the teachers. We need to educate the schools and early childhood programs or any others who come. Law enforcement who does the investigation of a 3 or 4-year-old. Those are the things that I think impact all the way through a child's life. And an example of that in a very serious case for a child of color is she was not able to read at 8 years old. And I myself thought she was having a learning disability issue, but it was when she finished her intensive trauma narrative that she was ending up in talented and gifted classes afterwards. Right now, she has graduated as a master's and she is a speech therapist in inner city, and she's leading a statewide 6th grade girls of color basketball team that went all the way to state tournament. These are the successes that keep us all going when you're really able to make that kind of a difference.
Yeah, absolutely. Powerful story. Thank you so much, Cheryl. Abby, you want to talk about the van?
The van's going to be great. Yes, so the van allow us to provide transportation to our East Side family. We did notice this year when we didn't have access to that we saw a drop in attendance during inclement weather, which, obviously the bus line is not super convenient when you're traveling with young children. So we're very excited about that. I think the other advantage for us with the United Way is just the relationships that we've built and and as we're out talking to people about the United Way and the 2-gen model and the benefits, we're also letting people know who we are. And that's really hard when there's a lot of really awesome work happening in Dane County. And so it's really hard for people to know who you are and what you're doing. So we've valued those relationships with the United Way. As for a success story, I think one of the ones that I think of is we had a family who was living in the hotel when we opened the center. They enrolled 3 girls. All 3 of the girls exhibited some pretty extreme behaviors, which would have typically, they would have all 3 been expelled. There were, from a typical program, there were other organizations involved. There was some talk about diagnoses and disabilities for the girls. And they've been with us almost 2 years. And it's been, we were able to help them connect with the road home, to get stable housing for the family, to see that stress just come off of mom and dad was amazing. And I actually was in the site yesterday when the girls got dropped off, and just to see the difference. I mean, it used to be when they got dropped off, they would go in 3 different directions and adults would be like running every which way. But they came in and they were received into the arms of the staff. And just to see them like relax into their caregivers and just know that they were safe and loved and they belong there, was such a contrast from how things used to be. And I was like, yes, the staff there doing this this amazing thing and providing this place of safety and nurture to kids who are in the middle of some stressful situations. Just like Sharyl said, we believe that we can provide a buffer to those early adverse experiences.
Thanks so much, Abby.
So I would say briefly, the beyond just the dollar investment, these connections through a larger social network, these presentations, access to volunteers, I think it's just really important to kind of spread the information and educate our community on the early childhood needs of families. And just an opportunity for other people who don't work in these areas to really have a better understanding of what families are facing. And once our community understands what families living in poverty and who have been impacted by trauma are facing, there's much more compassion, understanding, and continued investment through volunteers and donating. So I think it's really our community that has to step up, and the only way we can step up is if we know what the challenge is. The United Way does a great job of convening those different groups of people that need that knowledge. Similar to what Cheryl had said about the CEO understanding how to articulate exactly what it was that's being provided. In terms of success stories, our Welcome Baby program had been working with one family for many, many years. And like so many other families that we work with, the family was isolated. They faced constant financial insecurity that led to both food insecurity and housing insecurity. So it was just their basic needs being met was a challenge. To sort of focus on their childhood development was also difficult at the same time. But the home visitor was able to kind of work closely with the family, got them connected to resources that actually helped stabilize some of their housing and food insecurity needs, so that we could really dig into the developmental needs of the family. But as a result of the work we're doing, we never know what we're going to uncover when we're working with the family. And so they come to us with a couple concerns that they want to address, but we often unearth a few other things that might be really helpful. In this case, we certainly identified some early literacy needs that the child had, and we're able to make a direct referral and a warm handoff to our Parent-Child Plus program, so the child could continue and get some early literacy, their early literacy needs met, so they can get ready for 4K and kindergarten. But also through some of the screenings and assessments, we were able to identify that this young person had autism as well. And so we then were able to get them connected to SSI, Social Security insurance, for funding, and subsequently referred to the Children's Long-Term Support Waiver Program, which is a program that's funded by Medicaid that provides support and funding for very unique needs that some children with developmental disabilities and mental health challenges have. And so without going into the home and identifying some screenings, the autism diagnosis may not have been uncovered, which then would have impacted the trajectory for academic success and certainly addressing some of the developmental needs that this young person has. So through our work, we can certainly help with the attachment and connection, but we can also help identify some other things that might be challenging that a family may not know because the child is not going to school yet, may not be in childcare, and so other people are not seeing what's going on. This young person did ultimately graduate from our Welcome Baby program and had a younger sibling who we also then enrolled in the program. So we were able to continue to meet with the family, support mom as she kind of developed her own advocacy skills and really kind of strengthen herself as a parent and continue to kind of provide that continuum of care for the family. So this is just like one of the stories of many that I think we all have where we go in to support families and then we help connect them to things that we're kind of unearthing as we work alongside of them.
Excellent, excellent. Thank you all. Carly, do we have time for a question or two, or are we at the end of our time?
We do have a time for a question.
Anyone have any questions? Feel free to just kind of jump in and state your question. Okay, well, I believe that our panelists did an exceptional job at explaining and filling in a lot of the blanks for people. So it's very, I'm always inspired when I hear from the folks who are doing the work and that we are so privileged to be partners with you all. And so thank you for all that you do. Thank you for taking your time to be a part of things like this. And thank you for just continuing to make us think about the people and the community and the impact that is possible when we all work together. So I really, really, really appreciate the work that you all are leading in your organization. So thank you so much. Thank you, Lead United team, for having us, and I think you all take it from here.
Thank you.
Thanks, Sheldon. So thank you, Sheldon, for moderating our wonderful panel today. And thank you to Abbi, Sharyl, and Scott for all of your insights that you shared with us. I know I learned a ton, and you had all mentioned that part of this really is getting that education and awareness out there of all of these programs and how we can help and the impact of the donations that we give to United Way. A couple of the things that really struck me as you were all talking was that how much trauma can impact everything across the board in a family, including health, education, and income, and how all of those things are tied so closely together. And how building trust and partnerships are so important as we work with other agencies to build that set of services specific to families and help them remove barriers. And then getting the right services at the right time. How can we really help those families when they need it the most? And that the United Way funding is really helping our agencies continue the programs and expand the footprint of those programs and actually expand those formal partnerships so we have an increase in resources and services across the board. So really, really awesome to hear from all of you and all the great work that you are doing. I want to say thank you again to our Lead United members and our Step Up program members that joined today. Your investments are making this important work possible in the community and continues to do so. If you'd like to learn more about Lead United, there was a link in the chat there today, but also feel free to reach out to me or my co-chair, Luke Hunley. We're both more than happy to talk with anyone that is interested. So thank you again to our panelists and for Sheldon for moderating our panel, and to all of you for attending today. Thanks so much and have a great rest of your day.